Hello, everyone. Okay, we're just waiting for the last few people to connect. We're only a minute away from the start of the official start of the webinar. Thank you all for already being participating. Thank you for being available today. Good afternoon to everyone to start off with, because it's the afternoon where you are, the other side of the globe. We're very pleased to be able to organize and launch this webinar with the lack, unfortunately, due to the context of physical organizations such as congresses and exhibitions that we would have originally taken part of and met you there and presented you our devices during these congresses. Well, we're made to recreate ourselves, and for this, launching webinars is a good way of us to transmit information, educate everyone on different subjects that are important for us, and to get things going. So I hope you will all listen up well. To present myself shortly, I'm in charge of the export service with my colleague Pierre.
Nice to meet you.
So both of us work with our partners, international partners, liaise with them directly to make sure that our partnership is always successful and ongoing. And we have our special guest that has joined us, which is the Dr. Léa Jabour, who will also be hosting the presentation with us and describing all technical, clinical parts. So I'll let Léa maybe introduce herself.
I can see. Hello, everyone. Can you see me?
No.
No? Okay. Well, you can't see me. Okay. Okay, it's not a problem.
No, you can just introduce yourself,
Yeah.
Léa. We've got a lovely photo of you anyway.
Hello, everyone. I'm Léa Jabour, the new clinical trainer of DEREO. I hold a PhD in cellular and molecular biology with a cancer biology specialty. I'm glad to participate with you in this webinar, and I'm happy to answer your question at the end of this meeting. Back to you, Saskia.
Thank you, Léa. So yeah, today's principle is basically we have wanted to present Cristal PRO from another angle. The idea is that we've wanted from this presentation to offer you a complete coverage of all the interesting information around the state-of-the-art, latest generation cryolipolysis device, Cristal PRO. To start, I will be presenting the context we are actually in. Then Pierre and I will introduce for those who don't know it yet, and remind obviously for those who maybe already are equipped, the main advantages of our Cristal PRO device. Then it will go back to Léa, who has just introduced herself, who will take care of reviewing the background of cryolipolysis and presenting some clinical evidence. She will then continue with the expert advice, and then we're finished by answering all your questions. For this, if you could write them directly in the Q&A tab that you should see at the top of your screen, and we'll come back to them one by one at the end of the presentation. Listen up and enjoy. Since a few years now, it must be said the public prefers to do without the scalpel and really turn themselves towards non-invasive techniques. This explains in large part the rise of shaping or body contouring practices that allow the silhouette to be firmed, sculpted, or redesigned without surgery. We have been able to take profit, I will say it, in our industry of this whole COVID situation. Because due to lockdowns, everyone have been faced and forced to be looking at themselves and noticing what they want to have changed. Also, with the lack of physical exercise, people have wanted fast and effective body treatments to be able to release themselves once all of this situation is removed and avoid any social eviction. So due to these points, but also with the manufacturers always looking to develop new procedures, To meet the market's expectations, we can expect an important growth in the aesthetic field. As you can see here, by 2024, we should attend a growth of 5.3%, which is really amazing for our industry. Now, rather than a restricted diet or regular sports practice, the public expects to get rid of their fat and redesign their bodies effortlessly. This can hence a real commercial success for us. These numbers can prove this. So as you can see on this slide, 88% of patients are concerned by their silhouette and their weight. 72% of people will be willing to take the plunge for non-invasive procedures. And these patients also want more than a treatment. They want advice and to be accompanied post-treatment with your doctor's expertise. From this, you can see that 86% of patients who have completed body contouring treatments also would like nutritional support. And this is why manufacturers are recreating themselves and also plunging into a complete offer and a complete program so that the patients come into your clinics and go back with a complete follow-up regarding aesthetic treatments, procedures, and post-treatment advice. Dileo does offer a holistic approach, which we will give you a sneak peek on a bit later, further into the presentation. I'll now pass over to Pierre for him to start to present our fantastic fat-freezing, revolutionary Cristal PRO device.
So thank you, Saskia, for this wonderful introduction. So I'm very happy to participate at this webinar and to see so many people today. So now let's focus on the technical advantages that we're going to present you today. So this part will give you more knowledge regarding the latest innovation of cryolipolysis made in Dileo, the Cristal PRO. So as you know, we have more than 10 years in the aesthetic medicine industry. Thus, we acquired a strong expertise regarding our specialty, the body contouring. Thanks to our success with the Cristal Plus 5 years ago, we were able to gather feedback from doctors and the patients regarding cryolipolysis. That's why the Cristal device moved to a Pro version to offer a complete global treatment. As you can see on the right, the design is now more modern and luxurious, with major changes such as 4 applicators that you can use at the same time, the biggest temperature drop on the market down to -12°C, and of course, new morphological applicators for body and face area. As I told you on the last slide, one of the biggest changes is that the new version has now 4 applicators that can work at the same time. So you can treat up to 4 areas of the body and face during the same session, which is really time-saving for you and as well for the patient. Thanks to doctor feedback and your feedback, by the way, we understood the need to have a machine that is not bulky. That's why the Cristal PRO is very convenient, with the cord directly integrated at the back of the device. You can see them on the picture just there, with the black, champagne, cyan, and pearl cords. So in conclusion, the Cristal PRO is also space-saving and it will fit in every clinic. With this new version, you just need to plug the applicators into the cord. I told you it's really space-saving for you. These new applicators are especially made for each different morphology of body areas. From the right to the left, you will find the face applicators, agate, amber, and jade, then the body applicators, emerald, sapphire, ruby, and finally the flat applicators, amethyst. These new end pieces are very practical because they are light and can be stored in a small box. Also, you are able to see which applicators will suit the best during a pre-treatment session. Finally, they do not use any electronic inside, which means less malfunction issues. But Saskia will present you the system that Dileo engineers have developed. So as you know, the cryolipolysis is the combination of cold and suction. Regarding the suction, Dileo engineers developed a smart aspiration adjustment. So it allows a precise selection of the suction wanted for a better patient comfort. So from 0 millibars at -700 millibars. So the majority of our competitors today are only using level of suction, where you don't really know how much the vacuum level is, which is not very precise and doesn't adapt to the patient's feelings. So Leah will show you which kind of suction you need depending on the protocols later in this presentation. On the other side, the applicators have a new shape called soft comfort for fewer side effects. Your patient will be comfy while he will be doing a cryolipolysis session. Finally, the applicators have now a modern design that will match perfectly with the Cristal PRO. I will pass over to Saskia, who will talk about the cooling unit.
Thank you, Pierre. Wow, what a great bunch of advantages already, and I still have a few to present. So starting off with one of them, which is our new cooling system, and I can say it's actually our exclusive cooling system. It's patented technology exclusively by Delio. It's named Cooling Cavity Diffusing System. Now, it's explained by diffusing the cooling liquid that reaches the lowest temperatures desired and circulates in the entire cavity of the applicators. This allows stable, uniform, and obviously, thanks to the two first points, more effective treatments. Whereas beforehand, and still today, you may be used to the original Peltier system, which consists of having two side plates on each extremity of the applicators, which did allow the diffusion and correct diffusion of the cold in the system. But let's face it, what can be better than having a liquid diffuse 360 degrees in the complete entire round cavity of the applicator? It ensures that the body surface that you're going to treat is going to be completely covered and no problem regarding the fact that it could sometimes not be as stable as the two Peltier systems. Now, with this revolutionary cooling system, we can make a difference. Not only with the cooling system can we make a difference, we have offered with the Cristal PRO a new diagnostics tool, the ultrasound probe. Now, this probe will allow maximum accuracy. We are the only ones on the market that offer this feature, and it is extremely interesting for you users to have this feature. Leah will explain in detail how you can use this tool efficiently, but what is great about it is that it allows you to have scientific information. Beforehand, you would simply use the caliper, which you still have to use, obviously, to make sure and measure that the patient has enough centimeters to treat a fat bulge. But you would only just take before and after photos, which, if we can be honest, sometimes don't allow patients to visualize the changes. With the ultrasound, you can take precise subcutaneous fat measurements, which allow doctors and patients to have exact results and see the evolution. This definitely has an impact on the patient's satisfaction. Something else I wanted to talk about is our intuitive and ergonomic software. Now, any usual cryolipolysis device or any aesthetic device has an interface that is very technical, where you're basically selecting the areas that you're going to be treating and selecting the protocol that will be launched in function of the area to be treated. Now, Delio has really rethought its interface, and that's why we can say that we've brought Cristal PRO to the next dimension. With this software, which is completely patient orientated, you're going to start from entering all the patient's data, such as the name, date of birth, weight, and so on, which will be completely saved and registered into the Cristal PRO background and back office. So all this data that you will be entering, even the captures and the pictures with the ultrasound probe that I've just presented beforehand, where you have precise measurements regarding each patient you come in, all this information will be saved into the different patients' files, and you will be able to use and work with this information interestingly. Even for the next consultations 2 months after, you'll be able to have a real follow-up on the different specifications of the information that you have entered regarding the evolution of the weight, the evolution of the ultrasound measurements that you would have taken, so that you can really give a follow-up post-consultation information for the patient to walk away with absolute satisfaction. Now, you can also customize these settings, whereas when you're going to be entering all this patient information, the protocols are then going to be adapted regarding to this information that is entered. So talking about the protocols, our clinical department, where Leah works with them directly, is constantly working on studies to offer the most adapted and personalized parameters for each treatment of each area. As you can see on this slide, we have, through studies, identified which temperature, which suction level, and which duration is the best and the most efficient for each body area to be treated with better results. This is time saving for you as doctors, because you may have the expertise to know that regarding the patient you have opposite you, regarding the size of the fat bulge that they are presenting to you and that they want to get rid of, you can sort of probably estimate which sort of treatment will be adapted. But you have to encourage the patient to understand the whole procedure, go through the contraindications, inform them how they're going to be set up for this treatment. So it's very practical for you doctors to have all this information pre-registered into the interface of the device. So as said before, entering all this information, dates, date of birth, weight, the Cristal Pro will then calculate the BMI and automatically set the corresponding parameters to launch the best protocol adapted to the area to be treated. We also update our protocols once clinical investigations are approved. We are very looking forward to be publishing the new protocols that are actually in process and should be out shortly to be able to offer you the best standard protocols, such as -11 degrees for 45 minutes and -12 degrees for 30 minutes. Leah will come back to you about that a bit later in the presentation. Another point that is extremely interesting for you as users, but also for your patients. We have launched new gel pads that are completely, as you know, mandatory for any cryolipolysis procedure. We have designed these new cryoprotective gel pads to comply with the new medical device regulation, so that now our gel pads are classed as medical CE. So for you and for your patients, this ensures a maximum safety because we have optimized these gel pads so that their formula protects during treatments where the temperatures can reach -12 degrees. Through tests, long tests that we have done with organizations testing on the different formulas, we are now pleased to have these new cryoprotective gel pads that will be able to protect all patients' skins with these low temperatures. There is also another point that's interesting, whereas before, and we know this very well because our original cryolipolysis device with our original crystal gel pads, you had to unfold them, which wasn't as practical as our new flat format that will allow you to apply them very easily. So that's also saving you time when you have your patients and you're going to set them up for the treatment. We also have another point that we are very proud of, is that our new cryoprotective Cristal Pro gel pads are entirely made in France, which allows us a perfect control of the quality. We supply 50 of these cryoprotective gel pads with each device, and then respectively, you can order them through your our respective partner that will take care of accompanying you with the Cristal Pro. Now, there's something else that's new and very exciting. Pierre did give a hint about it earlier when he was talking about the applicators. Dilio always puts a point of honor with our engineering team to constantly research and produce innovative exclusivities. Now, we start the new year with one of them, a brand new applicator that joins the large range we already offer and permits us to have 8 different applicators. So we can say a big welcome to the Topaz applicator. The Topaz applicator, as you can read here, has a specific intelligent design to exclusively treat the thighs. Thanks to, once again, if you see on this photo here, its morphological shape and slightly curved, as we can see here on each side, It is perfectly suited to grip onto the different thigh surfaces, especially the saddlebags. Now, we encountered a great success when we launched the Amethyst applicator, which is part now of the standard range of the applicators a few years back. And we realized that the Amethyst is the only applicator that doesn't have a suction technique. So it basically, by the cold, is very adapted for the flat surfaces where you can't pinch the fat bulge enough to be able to allow a suction on the areas such as the thighs and sometimes on the abdomen areas. So from producing the Amethyst and then once again going through all the feedback with the different doctors and the different patients, we discovered that we could, and again, orientate a new applicator to be completely adapted for new indications such as the saddlebag. Now, you can order a Cristal Pro with personalized applicator configurations, so make sure you include a pair of these when you order your Cristal Pro, as you won't regret it and your patients will be delighted. Now, I'll pass over to Pierre. Thank you all for your attention during my first part of the presentation. Remember to post in your questions that we will come back to shortly and make sure we do not miss any. Back to you, Pierre.
So thank you, Saskia, for this very interesting presentation. So I know that we gave you a lot of information. That's why I will do a short summary of the Cristal Pro advantages. So no fake consumable on Cristal Pro, as Saskia told you, as Cool Sculpting did with card inside the applicators that you need to change after some treatment. So there are no consumable that you need after you have the device in your clinic. So this is very cost saving for you. You can use 4 applicators at the same time, as I told you, which is more profitable for you, as you can charge more per session because you are doing more areas, but also time saving for you because you can do more patients during the same day. Saskia introduced you to the CCDS cooling system that only belong to Delio in the market, which avoid any issue with the applicators because they are not using electronic inside. You got the huge range of morphological applicators, so including Topaz, we have a total of 8 different applicators on the market. You got the precise diagnostic tools, which is the ultrasound, allowing a better follow-up of the patient, thanks to pictures of the fat fold. You got the best temperature drop on the market at -12 degrees Celsius. That will give access to new protocol of faster treatment. So Leah will talk about that. You got all the pre-registered protocols, which make the Cristal Pro very easy to use for you and for your assistant. Then you have the cryoprotective gel pad that are classified as a medical device. So it shows safety for patients. And our device, as well as everything from Delio, is made in France for a better traceability and a proof of quality. You got also an adjustable smart suction system, which is very precise and will increase the patient comfort. The ergonomic and intuitive software using Android, which means it can be used by anyone. You got also the modern and the luxurious design that fit perfectly for your clinic. You got the possibility of saving patient files within the device, but also exporting it to your computer, which is very convenient. And of course, it is important to remind that this is still a non-invasive without any downtime procedures, which is wanted by most of the patients today. And finally, the Cristal Pro is registered as a medical CE 2767 device that shows safety through the following of European regulation. As I told you on my previous slide, gathering feedback from you doctors is essential to know your needs and thus the patient's needs. So the concept goes beyond the fact of losing weight. Today, patients want a harmonious and a dynamic silhouette. We understood this way of thinking and we launched the Cristal Body Healthcare Program last year. This program will be promoted at Monaco in April, and many KOL will be our guests. And by the way, we are never stop recruiting new KOLs, so do not hesitate to join us and take advantage of being part of the community. So basically, what is the Cristal Body Healthcare Program? This is a body contouring program that allows full body treatment, which will act on the fat through the Cristal Pro that we present you today, then on the muscle with Cristal Fit, and finally on the skin with the Cristal Skin, still without any downtime and non-invasive treatment. So this program made Delio the only company specialized in body contouring. And we will be happy to see you on future webinars regarding our other technology. So that's it for me and for Saskia. So if you have any question, do not hesitate to ask them in the chat. And now I'm going to pass over to Leah for the clinical side. Thank you.
Thank you, Pierre. I'm going to start with a small summary of the background story of cryolipolysis. Yes, thank you. The cryolipolysis technology uses the knowledge of a cold disease called the paniculitis. Between 1966 and 1970, 5 cases of paniculitis in children developing following exposure to cold have been described. In this perspective, cryolipolysis reproduces a cold paniculitis whose hallmark is inflammation of subcutaneous adipose tissue. Thus, this technology is easy to design. We basically need a cooling system, by a Peltier system, for example, or monoethylene glycol aqueous solution, or the cooling liquid Saskia talked about, and the production of pressure by vacuum. To continue with the story, in 2008, 2 American researchers, Menstein and Anderson, studied this phenomenon and published their data after performing cold-induced fat necrosis in numerous experiments that were done on pigs. They actually introduced a new non-invasive method for fat reduction with freezing, termed cryolipolysis. As we can see here, their data showed selective and significant subcutaneous fat damage after exposing sites covering 15% of skin of a female pig to -7 degrees for 10 minutes. The inflammation, along with the macrophage infiltration and adipocyte reduction, increased progressively from day 0, as we can see, till day 28. Thank you. Accordingly, a cryolipolysis treatment induces 2 main biological effects. The first one is indeed an inflammatory mechanism. The application of a localized cold induces a paniculitis in the fat tissue. The intraadipocytic lipids are crystallized, followed by the apoptosis of these fat cells with a triglyceride release, and then the phagocytosis by macrophages. The second mechanism is ischemic and is induced by the skin fold aspiration, which is responsible for a compression of the terminal arterial vessels of the adipose tissue, increased by a vasoconstriction related to the localized cold. An endocrine mechanism is involved, but it's still unclear. Okay. Doctors are required to consider the following conditions before treatment. Based on scientific literature, the contraindications are any history of cold-related pathology, such as cryoglobulinemia, Raynaud's disease, paroxysmal cold hemoglobinuria, PCH, which is an autoimmune hemolytic anemia type, sickle cell disease, C-section or recent surgery, pregnant or lactating women, hernias or areas around them, hemochromatosis, and scleroderma. As a precaution, doctors should avoid treating patients with a pacemaker, defibrillator, patients who suffer from post-herpetic neuralgia, or who have in the area to be treated open or infected wounds, or a recent scar tissue, or either any skin condition such as eczema, dermatitis, an allergy such as urticaria, cold agglutinin disease, any blood disorder or the use of anticoagulants, myocardial infarction or stroke in less than 6 months, infections such as HIV or hepatitis C, other liver pathologies, or any advanced grade of cancer. Adverse effects can appear immediately after treatment and may go on for several hours to several weeks. The common adverse effects include erythema, vasovagal discomfort, mild to severe pain during the treatment, bruises, nodules, edema, transient hyperpigmentation, skin sensitivity or loss of sensitivity, itching, tingling, numbness, or cramps. As for the rare adverse effects, they include burns, brown coloration of the skin, and paradoxal adipose hyperplasia, or what we call PAH, which is a condition in which the fat cells overgrow instead of getting destroyed, as we can see here in the pictures. We'll be talking about it in the next slide. In 2018, PAH were classified as infrequent or frequent complications of cryolipolysis. They are responsible for severe aesthetic damage and are characterized by a localized fatty hypertrophy in the treated area. The following risk factors for PAH were identified: male sex on the abdominal region, from Hispanic origin, with a cryolipolysis history and some genetic factors. The physiology of PAH has not been yet clearly established, but some studies have suggested that the apoptosis mechanism triggered by cooling and hypoxia of adipose tissue is responsible for secondary paradoxal hypertrophy of residual fat. The first imaging examination that we see here revealed no inflammatory processes for this pathology, only a superficial hypertrophy of subcutaneous fat. The second figure shows a histological analysis that was performed 5 months after cryolipolysis in the same patient. No hypervascularization or a decrease in the vascularization was observed in the living interstitial cells. Now we're going to talk about some clinical evidence. In 2016, DeLeo promoted a clinical study to assess the tolerance and efficacy of the Cristal cryolipolysis in obese patients. For that matter, 20 people were treated on the flanks, the abdomen, and outer thighs. The study showed a significant mean reduction of 30% of the fat skin folds measured by a caliper, as you can see, and a significant mean of 20% of the greasy fold thickness measured by ultrasound. Exactly, thank you. This is why it's important to have the ultrasound tool in order to assess the efficacy and efficiency of this treatment. Also, in 2016, a retrospective study was published covering 418 procedures of Cristal cryolipolysis. This study showed the total loss of perimeter of 2.79 centimeter and the patient's desire for a second session of 80%. Indeed, the satisfaction rate was quite impressive. Thank you. Thanks to the many visits to the doctors I've been with lately, I summarized few advices for a better use of Cristal PRO. To obtain satisfying results with the cryolipolysis, some important points need to be taken into consideration. First, choose the right indication. The criteria for a good indication are men and women of all ages who are in a good general health and do not present any contraindication. The treatment is indicated for a person with a localized fat deposit with a skin fold superior to 2 centimeters as measured with a caliper. The areas you can treat with Cristal PRO are the following: the chin, arms, bra fat, flanks, abdomen, saddlebags, thighs, inner thighs, knees, and the chest for men. And all these areas can be treated with the diverse applicators that already were presented by Pierre. Second, choose the right patient with a fat bundle that must be sucked inside the handpiece. That requires some laxity of the treated area. The selective indication of cryolipolysis is the medium abdominal bulge, which has a significant amount of fat and sufficient laxity to penetrate the handpiece. From our experience, this is the area where we see the best results. So the ideal profile for a cryolipolysis treatment is a person struggling to lose some localized fat despite an adapted diet and sports activity. Always inform the patient. During the first visit, it's very important to determine the patient's needs, explain the concept of cryolipolysis and the expected results, inform the patient about the risks. After all these points, you need to determine a treatment plan. Give the patient the information package and have them sign the consent form for the cryolipolysis treatment. Always be honest. The fourth point is the ultrasound system. This system can be used with the Cristal PRO device only. The ultrasound will allow to visualize and measure the thickness of the hypodermis, so the adipose tissue, before and after the cryolipolysis treatment. As we can see, the arrow on the second figure shows the hypodermis localized between the dermis, which is the second line from above, and the muscle fascia, the first flashy white line. So for each zone, a precise follow-up can be carried out to refine future treatments. To conclude, the ultrasound system of Cristal PRO will allow a better management and follow-up of the patient. It is essential, not even essential, indispensable that you use a cryoprotective gel pad on each treated area. This gel pad protects from cold and reduces the risk of burns. Make sure to position it correctly in order not to make folds, bubbles, and always extend it beyond the edges of the handpiece for approximately 2 centimeters. Performing a massage immediately after the cryolipolysis treatment is very important because it will stimulate lymphatic drainage and speed up the adipocyte removal process. In 2014, a clinical study was performed on 10 patients who underwent cryolipolysis treatments in 2 body areas. One side was massaged immediately after the treatment for a few minutes, which are the red columns. The other side was not, the green columns. The results of the study showed a constant and perceptible increase in the efficiency of the treatment of the massage site compared to the other one. The reduction of the fat layer is better of 68% at 2 months and 44% at 4 months. No signs of necrosis or fibrosis from the massage were observed. The last few tips. In case we're doubting or we're confused between 2 applicator sizes, my experience and the experience of the doctors will tell you to choose the smallest one for better results. For the inner thighs, for example, use small applicators like jade or amber. They have led to more successful results. For the saddlebags, you can use the new topaz applicator. We've tried it for 45 minutes at -10 degrees with a pressure of 200 millibar, and we showed we had great results. The studies on the -12 degrees are still in progress. What are the expected results for the cryolipolysis treatment? On the short term, the destroyed fat cells will be eliminated naturally over 8 weeks through our body's lymphatic drainage. 2 months post-session, it's necessary to make measurements and photos in order to see if a second session is necessary to reach the desired results. On the medium to long run, the results will be permanent as long as the patient maintains a healthy lifestyle. Should the patient not follow a balanced diet or not exercise regularly, the patient will be producing new adipocytes and a new session will be necessary. At the end, do not forget to love yourself with Cristal PRO. Back to you, Saskia.
Thank you very much, Leah. Thank you for all of these clinical explanations to remind us the background of cryolipolysis, what's important to know to be able to set up a good treatment, the contraindications that are obviously to be cleared with each patient before having a treatment set up, and obviously what the expected results are and how us, Dileo, as manufacturers, are always working, as we've been saying from the beginning, to design, recreate, and to launch new products, new applicators, new gel pads to go with and work with the cryolipolysis treatment for you users and your patients to have the best effective results possible. So we've gone through a lot of information today regarding the device itself, the technical parts, the commercial advantages, and then a background of all the clinical aspects. What we will be able to do is send you through this presentation, and now we go through the few questions that we have and make sure we answer all your interrogations. So a first question that has come through is, I think Leah will probably be able to answer this for Dr. Ho. Does the level of suction affect the result?
Indeed, the level of suction affects the results. However, we have to be really sure about the anatomy of the region we're treating. For example, for the chin or the arms, we can't use a lot of suction. Mainly, we can use 180 to 200 millibars because of the anatomy of this area. We have the radial nerve that is passing through the arm, and we have the submandibular nerve that is passing here. So any stronger suction might lead to tremendous consequences that we can avoid. So I suggest you to follow the pre-registered parameters for the suction, for the temperature, and for the time. And with time and with experience, you can modify, of course, with your experience and your sharing your result with other doctors and other experts on the cryolipolysis. You can start to modify a bit your parameters.
Thank you, Leah. Also, to add something about that answer, yes, the level of suction, as Leah has said, does affect the results. And this is once again why with the Cristal Pro, it's interesting to be able to adjust precisely the level of suction and not just have, like Pierre was explaining earlier, level 1, level 2, level 3, level 4, where sometimes level 3 will be too strong and level 2 won't be strong enough. We can really go between these for it to be comfortable for the patient, but efficient for the results of the treatment. We have also another question. When the ultrasound probe are to be used before and direct after the treatment? So Pierre will answer this for you, Dr. Tommy.
So thank you, Dr. Tommy, for this question. So basically, you can use the ultrasound before to measure the fat fold thickness, as told you Saskia and Leah, but this is not very relevant to take another measurement directly after the treatment. It's better to do it 6 to 8 weeks after the cryolipolysis session. It is really interesting to save the pictures because you will be able to show a before-after photo to your patient and see the real results of the cryolipolysis session.
Thank you, Pierre. I hope that was clear for you, Tommy. Another question maybe for you, Leah. What is the maximum number of sessions that can be conducted on a specific area?
The maximum number is 3. However, we rarely do 3 sessions for one zone, one area of cryolipolysis. Normally, 1 session is enough. Sometimes the patients want to have better results or wants to have like more refining of the results. So we do another one, and really rarely we get to do 3 sessions.
Okay.
From my experience, I've never done 3 sessions on anyone or seen any doctor done 3 sessions on anyone.
So like we encourage, one treatment can be sometimes enough.
Exactly.
The post-treatment consultation 6 to 8 weeks after with the measurements of the ultrasound, as Pierre has just explained, we can elaborate if it's necessary to do a second session, but very rarely do we do a 3rd session.
Exactly.
And maybe I can add, if you doctors are confronted with a patient that comes back after a 3rd session with still some targeted located fat bulges, maybe the patient isn't also working with the cryolipolysis treatment. What is to be understood, and it is extremely important, and it's you users, you doctors, that is to educate the patients during your first consultation, is that non-invasive treatments aren't obviously like surgery, where you are going to open and remove what is wanted to be removed by the patients. The treatment is the patients are going to have to work with the treatments. And this is why more and more us as manufacturers and doctors themselves educate the patients to work with nutritional or sports activities for them to be really accompanied and have the best optimistic results they expect. We have another question from Dr. Ho again. Leah, are painkillers encouraged after the treatment?
We don't usually give painkillers to patients because we don't really see the need for that. Usually after the treatment, we don't have that much of pain. But in case we have that, it's only everything with the basis of paracetamol. That's it.
Okay, and also we supply with
Arnica.
Yes, with the Cristal Pro device, as I was explaining earlier, you have a configuration of applicators that are equipped with the device, also the gel pads, and we add a little gift for you to give to your patients if they feel a bit of discomfort on the area that they have treated, which is arnica, which is pain relief cream. So they can apply it at home for 3 to 4 days on the area that's treated, and it will basically remove the pain feeling on that area.
And just to add one thing, it's better to apply it directly after the treatment. After we do the massage, before the patient goes back home, we apply it and he can go.
Perfect. Thank you, Leah. Another question. What are and are there any benefits of using the amethyst applicator on the arms?
The amethyst applicator, they're going to find the arm. For the arms, we have to be sure that this is not a problem of the skin relaxation. If we have the amount of fat deposits that are necessary to do the treatment, we do this. But if we don't, we have to treat the skin in another way. Mainly, as we propose here in Daleo, we might use the skin, the crystal skin, to treat the arms. So basically, we have to check if the problem is the fat or it's actually the laxity of the skin.
Okay, perfect. Thank you, Leah. Talking about other technologies, we have a question regarding combined treatments. I know you've worked a lot with different doctors who combine maybe LED and radio frequency. We have a question from a doctor. When can the patient be treated with radio frequency after a Cristal Pro treatment? How long after?
We can start treating the patient 1 week after. It's only, the idea is that we let the skin rest for a bit, we let the erythema go, and then we can start treating the patient with radio frequency. No problem.
Okay, great. Thank you for that. We have one last question. Can chest treatments be conducted on obese patients?
On obese patients. Normally we say that cryolipolysis is not a treatment for obesity. For the chest, it's only for men, and we have to be sure that this is a pseudogynomasty and not a gynomasty. So we have to be sure that the problem is not hormonal. Whenever we have this knowledge that the problem is not hormonal and it's only fat on the chest, we can treat it. We don't have a problem, but it's better to be sure of that. Maybe we need to do some tests, we need to do some echography, and then we can start treating the chest.
Okay, brilliant. Thank you for that. Actually, one last question has come in. Although it rarely happens, as you explained, Leah, in your slides, what should we do if paradoxal adipose hyperplasia occurs?
I'm sorry, can you repeat it? It cuts.
What should we do if paradoxal adipose hyperplasia occurs?
Signal it directly The patient should signal it to the doctor should signal it to the Leo, and the only, and unfortunately, the only solution for this is a surgical intervention. We don't
Okay.
have any other option.
Okay, I think that's clear. If you have any other questions, you can ask them directly to Pierre or myself through, I mean, all you doctors, you can ask them through your direct contacts who can ask us the questions. And if it's any clinical questions, we can direct them to Leah also, who will take a pleasure of answering any more clinical questions. We can have sent to you the entire presentation that we have gone through today for you to read over also the different slides and maybe have any other questions after that. Once again, thank you for being part of today's webinar. The next webinars, as Pierre was explaining earlier, will concern another technology that we have just very recently put out on the market, which is the Cristal Fit, which is the electromagnetic muscle stimulation. And we will be very happy to present this, and we will organize the next webinar around this, probably in the beginning of March. So follow up on all the latest technologies that we'll be putting out on the market, and it will be a pleasure to speak to you soon. Thank you, everyone.
Thank you.
Thank you all, and take care of yourselves.